evening, everybody, and welcome to Live Wednesday. We're so excited you all decided a show with live every week. But we are talking to the Office of Health. So, without further ado, welcome Director Samini, Elise, and Dana. Welcome to the show, ladies.
Hello, Tina. Thank you so much for having us tonight.
We are so excited to hear all what's going on with the Office of Healthy Aging. But for don't we start off by introducing ourselves and tell us what you do? Maria, we'll start with you.
Oh, thank you, Tina, and thank you for having me. And my colleagues at the Office of Healthy Aging, Dana and Aletha. We're so excited to be here. I'm the director of the Office of Healthy Aging in Rhode Island, and that's the state's agency, the state's office to serve all older adult Rhode Islanders, all Rhode Islanders age 55 and older, adults with disabilities, and their caregivers. And we're the area on aging for our state, which is a kind of federal designation. So we work every day to be advocates for the older adult community, the community of adults with disabilities and their caregivers, to make sure that the state is properly resourcing the needs of those communities, listening to the needs of those communities, and ensuring that people are able to live as they want to live and thrive in the community. So I've been the director there for just under a year now. It's exciting that in being there for just under a year, this is my second time being on your show. So thank you very much. And last time I was here solo, but tonight I've brought with me some of my colleagues. So if I can turn it over to Dana, and Dana, you can share a little bit about your work at the office.
Yes. Hi, everyone. Thanks for this opportunity. I'm Dana McCants-Derizier, and I'm the Community Living Director at the Office of Healthy Aging. I've been on board with the Office of Healthy Aging for about 3 years now. Time has passed already. Well, as the Community Living Director, in our unit with our fabulous team, we oversee lots of projects really focused in on individuals, older adults that are 55 plus, those with disabilities, and also in the caregivers as well. And so we really help those in the community really know about our programs, albeit nutrition and wellness, health information, and also supports for caregivers as well.
That's incredible. Aletha, tell us a little about what you do.
Hello, everyone. Thank you, Tina, for having me. My name is Aletha Dickerson. I'm Network Manager of our Community Living at the Office of Healthy Aging. I oversee our Aging and Disability Resource Center, as well as some of our respite programs for caregivers. So we'll be telling you a little bit more about our programs.
I'm here all out. So, Maria, what's the topic going on at OHA right now?
So, Tina, I want to start by talking a little bit about something as a kind of recap, I think, of your last guests, because it is a really hot topic. And that is that in Rhode Island, like every other state in the nation, Medicaid renewals are starting again. And so I couldn't let the opportunity pass to make sure that all of your viewers, all of your fans who are Medicaid recipients know that if they receive Medicaid over the course of the next year, they will have to renew their Medicaid. So they'll get paperwork where they'll have to confirm their current financial status. In Rhode Island, there's a special website. It's staycovered.ri.gov, where people can go and learn about the Medicaid renewal process and be connected to resources. And specifically for older adults who receive Medicaid, I also want them to know that there's support within the Office of Healthy Aging. So if someone was 65 years old before the pandemic, which is when renewals stopped in 2020, or if they've turned 65 over the last 3 years, with their Medicaid renewal, whether or not they maintain their Medicaid, they may want to look at their Medicare plan again. And there are community resources to help with that. So they're called SHIP counselors, and people can be connected to those folks through the Office of Healthy Aging. And that phone number is 888-48721. So again, those are folks if you're renewing your Medicaid, which everybody who's on Medicaid, watch your mail for yellow papers that will come sometime over the next year. And if you're over the age of 65 and you're concerned about how Medicaid may impact your Medicare, get help through the Office of Healthy Aging at 888-884-8721. So now that my Medicaid commercial is done, I also will share that at the Office of Healthy Aging, we are gearing up for May, which is Older Americans Month, making sure that we're doing some promotion of the great work that older adults are doing throughout the state. We focus a lot sometimes on adults with vulnerabilities, and that makes a lot of sense. They need to be connected to resources, and we have an obligation as a state to be sure that we're making resources available to them. But I also think that it's great during Older Americans Month to highlight the fact that older adulthood is a time to reinvent oneself, to maybe start a business or go back to school or just pursue dreams that maybe were delayed in earlier years. So I'm excited to be sure that we're focusing on all the great work that older adults do throughout the state. And we're hosting a special volunteer recognition event in the month of May for our adult volunteers who act as senior companions and as SHIP volunteers. So we're excited to do some celebrating. It feels like we don't do enough of that. So that's some of what's happening at OHA right now.
Well, I love celebrating the May because it is my birthday month. I don't like getting older, but you know what? It is what it is. So, we can celebrate older adult with my birthday. So thank you for that.
You're welcome.
Dana, tell us a few of the programs going on at OHA right now.
Yeah, I wanted to highlight some of our programs that we have in the community living unit. And so part of that is I'm going to dovetail off of some of what Alith is going to say as well, but we also have a program for kinship grandparents. So we have a close relationship with DCYF with their programming, with their folks in the community that are foster parents and those who adopt. So we thought with some of our funding, we could help out kinship grandparents. And so OHA partners with the Village for Rhode Island Foster and Adoptive Families to outreach to a diverse community of kinship grandparents and older adults that are caregivers, 55 years of age or older, who are not involved with DCYF. And so we connect them with services, supports, resources in the community for them to access services. And we also have this big networking community of kinship grandparents as well. And these are informal grandparents that take on their grandchildren that sometimes they don't think of themselves as caregivers. And so this program really recognizes them, helps them with resources, and makes referrals to different through different agencies as well, through the Office of Healthy Aging.
That is a fantastic. The Office of Healthy Aging does so much for so many. And I mean, we could spend hours. I could do a whole year with just you guys and Maria and still cover everything you guys do. But Alita, tell us a little about what you have going on at the Office of Healthy Aging.
Well, Tina, speaking of grandparents, I wanted to mention that one of the caregiver programs that we have is for grandparents age 55 and older, caring for their grandchildren. We have a program with the YMCA of Greater Providence and YMCA of Pawtucket, where scholarships are available for those grandparents who are caring for grandchildren age 18 and younger. There are scholarships to help with after-school care, vacation time care, and even summer camps. So folks can find out more by calling our Aging and Disability Resource Center. That's housed at United Way of Rhode Island. It's a call-in and walk-in center. The phone number is 462-4444. And if someone is interested in learning more about programs that we mentioned, please call the point. They can send you in the right direction based on, your wants and needs and preferences, especially for caregivers and adults with disabilities. I can go on and on about the Aging and Disability Resource Center. Again, we call it the Point. And they have person-centered option counseling for folks with disabilities who want to check out their long-term options based on their preferences and needs. And you can get one-on-one counseling to tell you what the options are so that you can decide, how best to either stay in place at home or to find services in the community to help you out. The Aging and Disability Resource Center also helps with applications for state and federal programs and can also connect you to food and housing, employment, you name it. But the staff is there during business hours. Again, call 462-4444, and there would be someone there to help you with your needs.
I'm just going to do a couple of things. Nobody's computer is glitching. Althea is sitting in a comfy chair. That is a picture. She was having a little bit of camera issues. So no, she is not frozen in time. That's actually a picture. And second of all, I was the commercial for Point. So yes, I said many times Point. And I was with Maria's mother, as well as Maria, in those commercials. So yes, you are not being fooled. How much we, and this is why communications have to work together. We all deal with something different. We all have different connections, but by working together, bringing the common cause and the common points to everybody. A little bit more of what's going on.
Do you mind if I jump in for a second? And I'm thrilled that you talked about being in the commercial with me and my mom. It was the highlight of my mother's life to be in a commercial for the Point. And it was such a critical thing to do because it is the way that Rhode Islanders who are older adults or adults with disabilities or caregivers can be connected to the resources that they need. Dana and Aletha are both part of our community living team at the Office of Healthy Aging. And obviously we all know everyone wants to live in community, and people as they age, as they have different mobility challenges, either due to age or due to disability, like what we want is to be able to remain in the community, whatever that looks like for us. And so through the Point, our Aging and Disability Resource Center, folks can be connected to the variety of services that exist in the state that Dana and Aletha oversee and have talked a little bit about already. When we were in the commercial together, Tina, I was there because so we were talking about the Point and how it's for older adults and adults with disabilities and caregivers. And while my caregiving for my mom is light touch, for other people, it's sometimes more. And as Aletha and Dana said, sometimes it can be hard to think of yourself as a caregiver. But really, when I go grocery shopping for my older aunt, or I help get my mom I change the batteries in my mom's hearing aids, or I set the doctor's appointments for my in-laws, that's all part of caregiving. And it's also popping in and visiting a friend who might be homebound. That's part of caregiving. And so one of the really wonderful things that we're able to do at the Office of Healthy Aging is to support caregivers, both with the resources they may need, like if they need to be connected to skilled caregiving, but also with giving people a little bit of a break, because caregiving can be draining on the caregiver, and even the person receiving care would like to see a new face every once in a while. So we're able to support people staying in their communities in those ways. And I think that Aletha might have been ready to talk a little bit more about those caregiving opportunities through our special care breaks program.
Sure. Can you hear me, please?
I can.
Yeah.
Oh, wonderful, because I was just asked to log in. But yes, for caregivers, we have a main respite program that gives caregivers a break is the Care Breaks program. and it's housed at Catholic Social Services of Rhode Island, but it's non-denominational. Anyone of every faith or non-faith can call and be connected with a home care agency, adult day, even assisted living or nursing facility if someone needs a break for a longer term other than during the day. We also have this program based on level of need. So if someone has a somewhat lower income, care breaks will help with the full cost for each day. If someone has a bit of a higher income based on the care recipient, they might be need to, just pay a little more. But in addition to this cost share program, as part of care breaks, we have a volunteer nursing student program through all 5 of our nursing schools in the state. So we have nursing students from the University of Rhode Island College, Salve Regina University, New England Tech and their LP program, as well as CCRI nursing students. They will volunteer to come out into homes to spend some time. And one thing that URI has done, and they're doing each week, is that they have group respite sessions down in South County for families with children who have medical needs. Parents or caregivers can drop the kids off for about 4 hours, and the physical therapy and nursing students spend time and have activities with the children while the caregivers, the moms, dads, can take a break. So there's some wonderful things going on. And again, the nursing student program is free because it's totally voluntary.
That's incredible. I'm a caregiver. I need a break from me. But unfortunately, I can't get that. But I do what think of taking care of me. I usually go out and do something fun. So even if you're to give yourself a break and just step aside and doing that. What are some of the other programs, Dana, that are going on?
Yeah, I'm glad you asked. We're really excited about our DigiAge programs. And really, DigiAge came about, these programs or projects came really about during the pandemic, really to address social isolation, loneliness. And so OHA really wanted to make sure that we connect with folks in the community, and the community connects globally throughout the community, and with loved ones, with their doctors, with banking. And so what we did through this time was we offered technology resources. And so we know that access to technology is increasingly essential for people living in the community. And so we provided through partnerships, great partnerships in the community with our partners, just the opportunity for those to get digital devices, connect them to the internet, and provide the training on how to use the devices. A couple of our great programs whom we partner with is the Ocean State Center for Independent Living. They provide older adults and adults with disabilities who transition from a nursing facility to home or community living setting, including participants in the nursing home transition program, with digital devices, internet services, and training on how to use the devices, and information on resources online. We look to really improve technology and internet with this project to really reduce reinstitutionalization and to help people to transition, and for those who are at risk for nursing facility placement, to help them to stay in the community. Another program is with the Rhode Island Parent Information Network. They provide individuals who are transitioning from the hospital to the community. And these folks are participating in the Hospital Care Transitions Initiative. Same thing, really offering them digital devices, internet services, and training on how to use the devices, and to really help them connect with resources online. This technology really provides participants on how to access their healthcare providers, to really improve access to getting information on public benefits, for example. That's another great program. And I don't know if folks have heard of the URI Cyber Seniors Program. They've been in existence since about 2015, but OHA just started partnering probably over the last 3 years. And so Dr. Sky Liedl, who leads the team out there, connects with 14 community agencies and senior centers statewide, and they also help to increase digital literacy and the use of digital devices. This program is for those who are 55 years of age and older, and we find that iPads are really the best source of use for older adults. And so Dr. Sky Liedl and her research really have found that really training folks on the iPad, really helping them to connect with resources through mentoring. They also use student mentors that are at URI, and they also have started a peer-to-peer learning experience as well. I would like to see someone my age help me how to use the iPad. So they've definitely provided those resources as well. And also,
It's so great because one second, it's so important that training because some of that training, I got my iPad, so I'm teaching myself as we speak because I took some of that training. But one of the questions that just came through, I do not want to skip and pass it. And Maria, this might be for you to answer. With technology comes scams and frauds. What is OHA doing to protect the older, now that we're teaching them devices, how do we protect them from scams and fraud? I thought that was an important question. I didn't want to let it go by.
That is a great question. And, for folks who've heard me talk before, they've heard me talk about there are things that we do at OHA and there are things that we like inform and we amplify. And we certainly, within our social media space, within some of the materials that we bring out to community centers, we're trying to ensure that people are aware of the most recent scams and frauds, things like gift card scams, things like the love scams that people just write to random folks on Facebook and tell them they have a nice smile. That's often an entry point to some danger. We partner closely with our colleagues at the Attorney General's office. And so if we do learn of scams, we're making sure that we're communicating with one another to publicize new scams that come down the pike. And also through our work, as I shared earlier, the phone number for our SHIP counselors. SHIP counselors are also trained in something called Senior Medicare Patrol, which helps seniors identify Medicare fraud and how to report Medicare fraud. So we also work in close partnership with the Attorney General's office to pursue when there are people who have become victims of scams or fraud, to be sure that we do what we can to bring justice in those cases. But we always want to start on the prevention side. So if you're a person who uses Facebook or uses Twitter, the Office of Healthy Aging has accounts on those platforms. And when we learn of new scams from our colleagues at the Attorney General's office, or AARP has a lot of great resources to identify and protect oneself against scams. Those are spaces where we're going to be publicizing the things to watch out for. And it's also part of the work that Dr. Liedl does with the Cyber Senior Program. There's a component about being safe online. The University of Rhode Island has also recently started a program called Courageous Conversations. And a component of that is about identifying where the safe spaces are on the internet and what we need to watch out for, to ensure that we're all taking care of ourselves and our personal information as we wade into these uncharted territory of the ever-changing technology that we all are encountering all the time.
Yeah, and I don't want anybody to feel that they can't reach out if they feel everybody gets scammed. I've almost been scammed myself. AARP has some great fraud town hall meetings that you can call in. They have a lot of great ones. I actually sit on some of their activities. You know, on one of their teletown halls about fraud. They have them about once or twice a month. It is another good way because as fast as it comes out, there's a scammer right behind it. There are so many resources out there. Don't be embarrassed. Only one because very intelligent people have been caught up in these scams. So you are not the only one. So be very cautious. I didn't. I just thought that was an important question.
Yeah, I'm so glad you asked it, Tina, or you shared what was asked. In my own family, I've had members of my family fall victim to scams. It happens like across all demographics, across all ages, across all income levels. And you're right, there's nothing to be ashamed of. And I mean, scammers are successful because they're really conniving. And so the
Yeah.
fact that someone falls victim to that is nothing about their own sense of worth or smarts. It's just that these scammers are professionals, and it's really a great component of the cyber senior work that we have in a partnership with URI that both has that intergenerational piece, but they're building that peer-to-peer component as well. And we all know people, like, we might be more comfortable telling a peer that we don't really know what's going on or we're concerned about something. And so or we might be more comfortable talking to a younger person who we have some distance from and can say, what am I supposed to do here? And so the powerful part there is that there are lots of opportunities for learning, and we really do want people to feel like they can ask the questions and have a safe space to turn to. And so the Office of Healthy Aging, our partners at the Attorney General's office, are really great places to learn more about what to watch out for and who to reach out to if you're concerned that you might have gotten caught up in something.
Yeah, thank you so much for clarifying that. Dana, I need to interrupt you so you can continue with that last program you were talking about.
Yes, thanks, Tina. So there's a new platform that we have added on to the DigiAge program. It's called Get Set Up. And so this program was specifically built for older adults, those who are 55 years of age and older. It provides a digital educational platform, and it provides over like 800 hours a week of interactive classes, live classes taught by older adults. There's plenty of categories on health and wellness, technology, personal enrichment, and there's some special guests involved. Say if someone has a specific something about culinary cooking, and so they have different guest speakers as well to kind of highlight some of the recipes that they have. And recently, Get Set Up put together a cookbook. And so we just got a hard copy of it, and one of the recipes is from a Rhode Islander. And so they wanted to make sure that we continue to engage our older adults. And it's a great platform. As I said, there's so many opportunities to get online. Certainly part of what we want to do at OHA is to give all these opportunities and to learn how to use, but also to stay connected to the world and things that you're interested in as well. It's an exciting platform. We could share another time too how it looks and how to get on. We can share the website, the URL as well.
And I don't
it is a great platform.
It's free.
Oh, it's free.
Make sure people know they have access to all those things.
Yeah, I've had some downtime since everybody knows I've been stuck at home without my van. I've checked out some of these, and I'll tell you, I'm not quite 55. Don't give away my exact age. I'm not 55 yet, but I found some of these programs very interesting, with cooking and the classes and technology. So definitely go on and check it out because somebody who's going to be interested. So share the URL, share the website, share the information. Uh, I'll see. I'm drawing blank.
Aletha.
Are there any other programs?
If I may, Tina.
Any other programs today?
Yes, I wanted to share that the Office of Healthy Aging also partners with the Alzheimer's Association of Rhode Island. And on April 20th, the Alzheimer's Association will have the annual Journey Conference for caregivers and for those with a diagnosis of Alzheimer's or dementia. The conference is going to be held from 8:30 until 4 at the Crown Plaza Hotel in Warwick. And if you want to find out how to register for this conference, or if you want to find out how to connect with any of the programs that we talked about today, please feel free to call our Aging and Disability Resource Center. The Point, a commercial again, but the number is 462-4444. And the conference for the Alzheimer's Association will have some folks exhibiting. They'll have some speakers. There'll be time to network with other caregivers. And it promises to be a great day. This is their 12th conference, their 12th annual conference.
And no pun intended, when how to register, follow my page, because I always send out a lot of promos for that, because that's one of the fun days that I like to attend. So just follow my page. But if you forget, like me, make sure that you follow my page. I mean, I hate to say about Alzheimer's, but and so Maria, just about to say something.
Oh, I was just going to say that while we didn't have the URL for Get Set Up at our fingertips, at the OHA website, which is oha.ri.gov, you can link straight to Get Set Up there and participate in a whole host of free classes, from, as you've both shared, from cooking to art to technology to business programs and so forth. So, and you can also learn about all the other programs that we talked about today. So Aletha is correct. The Point is the way to start. 462-4444. But on our website, you can follow links to Get Set Up. You can learn more about the kinship programs, the respite programs, or if you're a person who's looking to volunteer yourself, there are also volunteer opportunities through the Office of Healthy Aging. So we have a senior companion program where older adults visit other older adults. So if you're an older adult who is active in the community and have the ability to go visit other older adults who might be homebound, the senior companion program might be interesting to you. Or we have volunteer opportunities through SHIP, which I've mentioned. Those are not necessarily older adults, but you can be, who help other folks figure out what type of Medicare plan is best for them. And we have a volunteer guardianship program where people who are in an institution and they don't have family who are able to help guide their medical decisions. We need volunteers to help people who are really the most vulnerable folks among us, who need medical care and need someone to help guide their medical care. And so opportunities like that, so light touch, visiting folks, having a cup of tea, all the way through really formal arrangements to help people make sure that they have access to appropriate medical care, are all volunteer opportunities through the Office of Healthy Aging. So you can learn more about all of our programs at oha.ri.gov.
And all those numbers and website and everything are in the comments below. So no matter what site you're watching this is, you can just go to the comments below and all of those are tagged there. If you forget all of this, you can always reach out to me personally, so I can give you their numbers so you can haunt them. I can also send you their website so you can haunt them. So I do it often, so they'd love to hear somebody other than me once in a while, because I call a lot, because it's such a great resource. It's such a great place to start at the Point and then go right through to all of care. So I urge you to check out their site, check out, get involved, volunteer, because nothing makes you feel better than giving advice. I do it in all aspects, and I it keeps me going because it gives me to do. Have I missed anything? Any one of you? Have I missed anything that we haven't talked about yet? Is there something that we need to make sure that
I feel
I
like
have another question that just came in.
okay.
The question was, what if you don't qualify for Medicare anymore? How do you know if you don't qualify anymore if you were already getting it?
I'm sorry for with the question was about health coverage. Is that right?
Yes.
Okay. So the renewal process that's happening right now or has been initiated right now is for Medicaid. And so that meant that someone was low income, maybe has had a level of care need. If you receive Medicaid and you live in Rhode Island, at some point between this month and a year from now, you will get a yellow letter in the mail, and that's a renewal form. The yellow letter might say you have been automatically renewed. And if it says that, you don't have to do anything at all. You're just going to keep your Medicaid. The letter might say that action is required. And if action is required, then you need to answer some questions on that form and maybe send in some information to the Department of Human Services. And then you'll get a letter, they call it a benefit decision notice, to let you know if you're still eligible for Medicaid. If you are under the age of 65 and you're no longer eligible for Medicaid when they do the renewal, you'll be able to access assistance, health insurance assistance through HSRI, which is our state's healthcare exchange. And the letter will give you information about how to select a new health insurance plan. And there are some opportunities to help defray the cost of that as well. If you are no longer eligible for Medicaid, or if your Medicaid changes and you're age 65 or older, you can then review your Medicare plan. So typically, people can only change their Medicare plan every fall. You select it and then you have it for a year. If your Medicaid changes, then you're eligible for something called a special enrollment period. And so if your Medicaid renewal is in June and your Medicaid changes, you may want to look at your Medicare plan, see if it still suits your needs best. And if you want to change it, you have an opportunity to change it outside of that normal window. But I do want to be clear that Medicare is not changing right now. But if you get Medicaid, and those words are too close to in sound, if you get Medicaid and your Medicaid changes, then you have an opportunity to change your Medicare to be sure that it still suits your needs. I know it was a mouthful.
I don't have the right idea what to close together. But another quick question just came up. Can you give a quick explanation of the difference between Medicare and Medicaid?
I can, yeah. I should warn that there are nuances that I definitely do not know. But typically, Medicaid is for low income individuals. So it's based on your income level. If there's a child under the age of 18 in a household's income can be up to, I want to say 260% of the federal poverty level, but no one should quote me on that. If someone is a caregiver to a child, they can get Medicaid with an income up to about 175% of the federal poverty level. And then for adults between the ages of 18 and 64 who do not have a child, who do not have caregiving responsibilities, they can get Medicaid with incomes up to 138% of the federal poverty level. I know it's like all gobbledygook when we're talking about federal poverty level numbers, but you can go to the DHS website, dhs.ri.gov, or the OHHS website, ohhs.ri.gov, and learn what those poverty levels equate to in actual dollar figures. And so if someone is low income, they can get no cost health coverage through Medicaid. Medicaid is also sometimes available to adults who have something called a level of care need. You might have a disability and need someone to come in to provide home care or homemaking services. And so for those folks, their incomes don't have to be quite as low. They still have an income threshold, but their level of care can make them eligible for that no cost health insurance. Medicare is available to everyone age 65 and older in the United States. And in some circumstances that I do not know, it's available to some people who are under the age of 65 as well. When someone turns 65, they actually must get a Medicare plan. If you do not enroll for a Medicare plan in the year that you turn 65, you pay a penalty for the rest of your life. So it's very important, but no one will miss it because all of the insurance companies know you have turned 65 and they're going to mail you so many things to tell you to sign up for Medicare. And AARP is a great resource at that time, and our SHIP counselors are also a great resource at that time. And Medicare is what people have heard of with Part B plans and Part D plans and Advantage plans and commercials in the fall. And so that is generally the health insurance for adults in the United States who are age 65 and older. I know it's incredibly complicated though, so I do encourage people to call our SHIP line, and I'll give you the number again. That's 888-884-8721. Or you can call the point at 462-4444. And folks at both of those numbers can help talk through the nuances of those programs.
And don't feel bad if you up or you don't drink, because I live in this world and I'm never saying the wrong one. Just because I don't know who was that close together. But basically, think about it. Medicare is federal, which everybody in the United States. Medicaid is Rhode Island. So I think of it as aid. You need when you're low income, you need the aid. So Medicaid goes with that, and Medicare, everybody gets. So I think that way, but I know it's very different.
Yeah, I've heard you say that before, Tina, and I'm going to repeat it because you were breaking up just a little bit, and it is a good way to remember. So I want to make sure people have heard it because it's a great way to remember that Medicaid is aid for people who are low income. Medicare is for older adults, and we care for older adults. And I've heard you kind of give that description before, and it does help to kind of keep in your head. So I'm glad that you shared it again. Thank you.
Yeah.
Oh, thank you. Dana, is there anything else that we missed?
No, I think we captured as much as we could tonight.
That's great. Aaliyah, why didn't I see your name tonight? I tell you every meeting that I'm at, if for some reason tonight my brain is blocked. Is there anything that I made with you tonight, Miss Dickerson? How's that?
That's okay. Tina.
Oh, Aletha,
They
did you
covered quite a bit tonight.
Share?
We do. Yes, you can't hear me. Can you hear me?
I think we lost.
Yes, go ahead, Aletha.
Oh, you can hear me now.
Yeah.
No, I was saying we covered quite a bit tonight, but also remember we have our congregate meal sites where folks can go to many locations throughout the state to get a hot or a cold meal. This is for folks age 60 and over, as well as their spouses who might be younger, or if they have someone with a disability living in their home. And also we have the home delivered program, Meals on Wheels. And just call the point if you have any concerns with food, transportation, employment, etc. So, I mean, that's our way to help you to connect with all of the programs and services, as well as people to just listen and find out what your needs are, and then they can advise you regarding some options.
If you haven't figured it out tonight, and call the point. That is the bottom line. That is the be all end all, and we should start. So I'm going to ask you, all you ladies, the same question. We're going to go right down the line. Give us your 1 minute roundup why everybody should interact with OHA and the point. Marie?
I'm starting us off. So first, let me just say thank you, Tina. It's been lovely to spend some time with you tonight. And OHA is such a great, important state resource. Everyone in the state of Rhode Island is either age 55 or older, an adult with a disability, or a loved one of someone who is age 55 or older, or an adult with a disability. And I know that when new things come up in your life as parents age, as bodies change, like we wonder, like, what am I going to do now? I need something. I can't get up the stairs like I used to be able to. I don't know if I can leave my mom alone anymore. And it can be scary and we don't know where to turn. And so the Office of Healthy Aging is the place to turn. We are working to make sure that people have the resources that they need to stay in the community. You heard today about caregiving supports, about respite, about some food supports. We didn't even touch on the case management that we do for adults who might be self-neglecting. We didn't really touch on the healthcare programming that we do. It's really quite a bit of, there are quite a few resources that are available through OHA. And just to maintain our commercial, we also through OHA support the ADRC, the Aging and Disability Resource Center, called The Point. And it's an excellent entryway, an entry point, if you will, for all of those questions. When I've called, when I have had something come up with an in-law and I didn't know what to do, I've called The Point and said, where do I turn now? And so just think about that. As the director of the Office of Healthy Aging, I also didn't always know where to turn, but I knew that if I called The Point, I would be connected to where I needed to go. So thank you for having us here tonight to talk about OHA, to give our Point commercial, and to just talk about all the resources that are available at times when people can feel kind of isolated and they don't know where to go. So thank you, Tina, and I'll hand it off to Dana if that's okay.
Yeah, hi, Dana.
Thank you, Director. I think you summed it up really well. And I just wanted to add as well, there's certainly no shame in being informed and getting some information and staying connected. What I really appreciate about the Office of Healthy Aging is that we connect not only with most and all of the state agencies, so that if we can't help you with a particular item, for example, a particular service such as housing, we certainly don't, deal with housing, but we know where to connect you with, to refer you to. As we were talking about The Point, as we were talking about our community partners in the, that do a lot of our services out in the community. So I like the fact that not only do we connect with state agencies, we connect with partners statewide as well. So we're full of resources, and so certainly reach out. We definitely want to connect you to the folks that can really help.
Thank you. Aletha, see, right once tonight. Aletha, can you please give us your 1 minute?
Yes, I'd like to say a good reason to connect with us and The Point is that sometimes, if an older adult or a younger adult is suddenly faced with a new condition, disabling condition, that's making them difficult with their activities during the day, or if you have a loved one who is facing a new challenge with a disability, you may not know what's out there. You may not know what resources are there to help you. So I can't stress enough to call The Point. The staff at The Point are equipped to speak other languages. They have Spanish speaking and Portuguese speaking folks on staff, and they also can connect with interpreters to help folks who might might speak other languages. Also, the Office of Healthy Aging, we connect with agencies across the state in diverse communities. We connect with the Southeast Asian community, West African community. We're there. We want to be there for everyone. And we even want to invite folks, if they'd like to get involved, call The Point. We have a Family Caregivers Alliance, which is looking for caregivers to get involved, to help us, advise us how to best reach your community or your church group. So again, please call 462-4444. We're there to help you, but we're also there to hear from you.
If you haven't figured it out by now, It's 444, just in case you missed it tonight. Thank you, ladies, all so much. And Maria, there is so much more that we have not talked about, but don't fret because Maria is a reoccurring guest on our show, and we will always have her back to talk about the latest, greatest things with OHA because Rick loves to partner with OHA. So thank you, ladies, so much for taking tonight and spreading your message and everything that you do. You do so much for Rhode Islanders, and it's nice for Rhode Islanders to see the faces doing work and the teams behind. Thank you very, very much for for being on the show and taking the time tonight.
Thank you, Tina, for having
Thank
us.
you.
Thank you,
Have a
Tina.
good
I'll come
night.
back anytime. OHA loves to partner with Ramp and with you. So thank you.
Oh, awesome. Can't wait. I invite everybody back next week, same time, Wednesday to Rhode Island Women. I need the accessibility. They build the accessibility. They match made in heaven. So make sure you all come back. All about in the trainings. And I always say, don't sit there, make a difference. Have a great night, Rhode Island.